thank you for joining us for Prep for All's newest initiative, Prep Advocates Unleashed. I am Michael Chansley, the Communications and Mobilization Manager, and today we are joined by Sabas, a Florida native who is now currently living in Michigan. Sabas is going to tell us about some of the ways that he's helped his community learn about and access PrEP, and some of the challenges that, even as an advocate, that he has run into. Sabas, want to tell us a little bit about yourself and how did you first learn about PrEP?
Yeah, thank you, Michael. So I'm Sabas. I am about to turn 26. I'm a student getting my master's in social work, living in Michigan right now. I'm a Floridian, born and raised, happily Colombian American. And I actually learned about PrEP from my work doing HIV prevention in my last job down in Florida. I worked at an LGBTQ community center, and before that, I was a sex educator in college, but I actually really didn't know a lot about PrEP. So it was really through like entering queer advocacy work that I like eventually learned about PrEP and became an advocate in that way.
So, what made you decide to get on PrEP?
So it had been at least a year of me, testing people for HIV and learning about PrEP and educating them and like telling them about um advising them on like what would be best for their lives. And then I eventually realized like once I was single and decided to practice polyamory, that it would be the best thing for me just so I can have a peace of mind for like my health and the health of any of my potential partners. And I was really lucky to like have a support system and the resources available to start PrEP.
And how did that change your love life or your sex life?
It honestly just granted me a sense of like freedom and ease. It was just like it didn't have to be on the top of my mind. I still used other like safer sex like methods, but it was just another like tool in my belt. So I knew I was getting tested regularly for HIV and other STIs because of being on PrEP, which was really helpful for just like lowering anxiety and also letting me like explore my identity as a trans masculine person. I was also exploring my gender as I was starting PrEP. And so it made me more comfortable going into those queer spaces, knowing I was protected.
Right. And I'm glad you brought that up because I've had similar experiences with going out into the community and educating people about PrEP. And I've actually had people, even including mentors who I've looked up in, advocacy work, who told me, "Oh, you're encouraging people to go around and have condomless sex." And, I think when we're used to talking in the community a certain way, and using certain prevention methods, it's kind of hard to convince people to adopt new methods, that can allow people to choose to use condoms or not. But a lot of people do use, I would say, people who are on PrEP, that's the medication itself is not their only preventative method. You have PrEP, you have doxypep, you have condoms, you have partner, um, conversations, regular STI and HIV screenings. And I think people don't realize that being on PrEP means using not just taking a pill, but having a robust amount of options, to take control of your sexual health.
Exactly. Yeah. Like it's not just the medicine, it's also like the education and like health literacy that comes with it.
Exactly, exactly. So tell us a little bit about your experiences trying to get on PrEP. Did you experience any challenges along the way? Did you experience challenges staying on PrEP after you've gotten on it?
Yeah, so I started off, I tried to go on PrEP by finding like a regular doctor. I used the PrEP locator or the PrEP navigator that I knew of because of my job. And then I had a little bit of trouble because like when I ended up going to just like a general health practitioner, I had to remind the doctor why I was there, even though it was like the only thing on my, record for being there was like I wanted to initiate PrEP. And so it didn't feel very like personable that like they wouldn't look at my chart even before I like got into the appointment. And so I did eventually start PrEP at that clinic. And then I was able to start taking PrEP at the clinic within the community center I worked at that is like HIV and AIDS like focused. And that was just such a better experience. My nurse practitioner was like so personable. It helped that we had like a working relationship and we could talk about like the nitty gritty of it because like I understand like the science and everything going into it. So it felt much more comfortable like having those conversations that were like very like vulnerable about like my sex life and my health. And then I did have some challenges once I decided to quit my job and move across the country for school because I lost my health insurance that came with my job. And I was planning on, I thought it would be accessible for a few months after I moved, but it ended up getting cut like a month early. And thankfully, I had some PrEP still because I was able to have like a 90-day supply, but then I ran out and I ran into health insurance issues with my new like student health insurance. And so at one point, I was like out of PrEP and it finally came through to the pharmacy and but it was still having insurance issues and I got a notification from my pharmacy saying we're having insurance issues but this prescription is ready for you to pick up if you want a 90 days supply of PrEP it'll be over $3,000 and at that point I was used to being on PrEP for free for like a year and a half and that was just shocking because I knew that it was like expensive in theory, but that PrEP is supposed to be free for everybody. And I knew there were like patient resources through like the PrEP manufacturers. But at that point, I was like, I'd rather just like practice other methods or like pause my like activities than pay over $3,000 out of pocket for something I know should be free. So that was like a really frustrating experience, especially being a PrEP advocate. So yeah, it was an adventure.
Right. And I think that's a big misconception that people have that when you're an advocate, you have an easier time navigating these systems, but advocates fall out of PrEP care and HIV treatment care and support services. We advocate for a lot of other people, but we have to also advocate for ourselves, and that's not always easy for us. So especially when accessing these different systems of care is just may not always be available to people, or you may run into hurdles. Especially a lot of the work we do with Prep for All is advocating for a federally funded national prep program because someone going from Florida to Michigan should not have challenges just because we don't have like a uniform system of care for people who are trying to access prep care in the United States. So, um,
Yeah, 100%. And I consider myself lucky that, I was in the situation I was where I like was informed enough to, make the right choices for me. But I know when I was doing HIV testing, one of the first people that I tested that tested positive was there to initiate PrEP again, which was just like such a frustrating experience, because, that person was doing everything right and they had been on PrEP and moved across the country also, and so lost care, and then ended up seroconverting, and it was just so frustrating having to like share that news when it could have been a completely different situation if we had accessible PrEP for everyone federally that could have prevented so many situations like that.
And thank you for sharing that because that brings us to the next question, which is if we didn't have access to free programs or low cost programs, we have threats to HIV funding going on right now. By the time this video comes out, I don't know where we'll be in that fight. But what would the impact be on your community? People who look like you, people who you socialize with, people who you've advocated for, what will be that impact of we if we had less free or no cost programs to be able to access prep?
It would be really devastating for my community if we lost more access to accessible PrEP, whether it's like free or no cost programs or even programs that make it just a little bit easier to access, whether it's like a pharmacist that's more informed. I know there's all sorts of programs. Back home in Florida, we just lost HIV prevention and STI prevention funding for the whole state. So I know the impacts of that are going to be far reaching, especially in my community. Like queer people are one of the main like targets or the target audiences for PrEP, but we still have such a hard time experience it, especially like people of color, that is like my community. And there's just so many more hurdles and barriers to accessing healthcare and like getting that health literacy and education that you want because the system is so stacked against us. And it just becomes so frustrating having to experience whether it's like racism or like cis heterophobia, like in the clinic when you're trying to like, be empowered and have a conversation with your doctor, but you're like having to like correct them on your gender or like a misconception they have. And I know it's also so frustrating in general before all of these attacks were happening, like there's not a lot of education and information and research on like transmasculine individuals. That was an issue I would come across when, I was having all these meetings with pharmacists and I was like, okay, but where's the data for like people like me? And they're like, oh, well, it's not out there. We couldn't find them for our studies. And I'm like, that's ridiculous because I think every transmasculine person I know or I could know would want to be protected from HIV or want to have access to HIV care or HIV prevention. And it's just like people aren't doing the work to find them or find us. And so having even less resources and less access is just going to make it that much harder. And it's going to make it like make the problem of HIV even worse because like it is possible for my generation to be the one to end HIV, but not if we're under attack like we are.
I don't think research has been inclusive of as inclusive as it should be of transgender individuals. Whenever we have like an awareness day or a campaign, and we go to look for statistics, those statistics just oftentimes do not exist as in a way that they exist for cisgender individuals.
Mhm.
And now with the attacks on the trans community and the attacks on funding for research, that leaves an even larger gap now for being able to find out if what we're doing is successful at reaching people. Where do we need to make changes on reaching transgender individuals? When we don't have that research, it makes it harder to actually provide quality services for the most marginalized people in our communities.
100%.
Right. So tell us, how did you become a PrEP advocate?
So I became a PrEP advocate once I started working at a queer community center. I had actually done sex education in college with a reproductive rights organization, but even there, we didn't talk about PrEP, and I might have like seen references to it, but I really didn't know what it was. We didn't really talk about HIV, interestingly, even though we were college students and young people especially need, HIV protection. So it was only when I entered that queer space of HIV prevention specifically that I really became informed about PrEP and then became an advocate from there once I realized like how important it was and what an amazing resource it was. Because I can only imagine 40 years ago, if PrEP was around, how different our history would have been. And so it's amazing that, it exists now and there's even more, resources becoming available in terms of different types of PrEP. So once I learned like how much of a difference it can make in people's lives, I really became an advocate from there.
Right. And there's so many different aspects to this work, from policy advocacy to helping people navigate services. If someone were to ask you, said, hey, I don't have much experience or any experience, but I'm really interested in becoming an advocate, what steps would you tell them to take to become an advocate?
It's a good question. I would say the steps to becoming an advocate are honestly really similar to the steps for advocating for yourself in the doctor's office. Because whether you're advocating for yourself or your community, you have to build those same skills of, knowing what you believe in and then just having the courage to stand up for it. So I think, looking into the resources and organizations of people around you that are also passionate about what you're doing, because even if you don't feel like there are other people around you, there are. And sometimes you just need to start the conversation. But then looking into, whether it's something that you can do virtually, or a resource organization that's like a little bit outside of your town. There's so many ways to advocate for PrEP, whether it's like, going to your school or your like city council and trying to change policies, or going to doctors' offices and trying to educate doctors on HIV and PrEP, because you'd be surprised how few doctors know enough about PrEP, and how many doctors will just say, oh, that's like an epidemiology thing. Like, I can't do that. But like your general doctor should be able to prescribe PrEP, you know?
Right.
So there's so many different ways you can approach it.
What would you tell people who want to get on PrEP and they run into challenges? Like, how you seem like you are pretty good at advocating for yourself and having those conversations with providers. What tips would you give others for advocating for themselves in a medical environment or in a testing, a testing facility or something like that?
That's a really good question. I think advocating for yourself is a really difficult skill that you just have to practice over time. And it's also really based on what you know, because you don't know what you don't know. And so if you already know enough that you want to start on PrEP or talk to your provider about it, I think doing your research is the most important thing you can do. So look into local resources, especially if they're accessible to you, which we don't all have that luxury, especially if you're in a rural community, etc. So looking up what's near you, because sometimes there are, HIV advocacy organizations or queer advocacy organizations, and having a person to talk to is so helpful, who is informed of like what is available for you. And if that's not possible, then looking online for resources. So like looking for PrEP for All, or there's so many resources out there about like what PrEP is and like people's experiences being on it. And even websites like the PrEP locator to see like where you can access it. So I think like educating yourself and doing your research to know what you want and what you can get and what your rights are as a patient is so important, because everybody should be able to access PrEP for free, but not everybody knows that. And that's with or without health insurance. So like educating yourself on that, and then bringing all that in with you. I always have like my phone out in a doctor's appointment with my notes app that has uh, like 50 questions written out. And like I come in ready, because I know when you're there across from the doctor, sometimes it can be really nerve-wracking and you'll like forget everything that you wanted to ask. And then you like kick yourself like an hour after the appointment, being like, oh, I forgot to ask this because I was
Right.
like nervous, even if the person is like really nice, there's just that like power dynamic. So I think like coming in informed, even bringing a friend with you if you can, or like practicing conversations is really helpful. If you're like nervous and you're just starting PrEP, like talking to a friend about why you want to start PrEP can be really helpful. Also, just for yourself, of like centering yourself and like why you care about your health practice and like what you want out of it.
Thank you so much for joining us today and sharing your experiences, but also sharing what you see as the impact on the community if we didn't have these resources to be able to access PrEP. So, thank you so much for joining us and sharing. If you want to find out more about the work that PrEP for All does, and you want to figure out how to become an advocate as a PrEP user or as someone who's tried to get on PrEP or who has previously been on PrEP, you can go to prepforall.org/PrEP saves, where you can also watch more videos about PrEP users and the challenges they've had and how they've overcome those barriers and continue to advocate for better PrEP access. Thank you again for joining us today. Signing off.